and our Tide Pods. So if you'll, yes, travel with me to a different part of the body today, the mind, we're going to tell you, or really just sort of like walk through what is digital mental health. Before we kind of dive into that, though, I just want you all to imagine that you are 15 years old. I know that that might not have been your favorite period of life. Not a lot of people want to think back to high school, but just for the time being, imagine yourself as 15 years old and struggling with anxiety. And so we know that by about the age of 15, research suggests that about half of all lifetime mental disorders have started by then. And so you're this 15-year-old who lives in a rural area and you rely on your parents for transportation, right? This is the US. You probably don't have even a learner's permit yet. And so even though your parents want to be able to get help for you, the closest mental health care provider is over an hour's drive away in the nearest city. Right? So you're struggling maybe with friendships, with school, with other parts of your life, and your parents, really want you to be able to get this help, but they can't afford the fees even for this provider since they don't happen to take the health insurance that covers you that your parents have. So your parents are really trying, they're looking for other clinicians, but there's higher demand than availability for mental health care providers. This is the case in a lot of parts of the country, but particularly in rural areas since healthcare providers and mental health care providers especially are really concentrated in urban areas. So unfortunately, the deck is really stacked against you, even with supportive parents who are trying their best to kind of figure out how to connect you with services that might be able to help you with your anxiety. So we're hoping that digital mental health can help kind of bridge this gap. So digital mental health care is the practice of healthcare that's over mobile devices, like tablets, computers, if you're old enough to remember PDAs or Palm Pilots, potentially even those, but most likely it's going to be your laptop, your phone. And it's part of a larger type of healthcare that's called telehealth or telemedicine, which includes other forms of distance care. So you might be thinking of, say, like meeting with your doctor over a Zoom call. So in mental health care, digital mental health care typically refers to web-based programs and smartphone apps. So some ways that we can try to envision digital mental health care as part of the solution is something that can kind of help close that access gap, right? Like if you're that 15-year-old, being able to address some of those barriers to being able to access that mental health care that you want or need. And another thing that this didn't come up in that example that we started the little chat here with is that this also offers an opportunity to potentially have reduced stigma about seeking mental health care. So for a lot of people, they're concerned about potentially being labeled as having some kind of mental health care challenge, and digital mental health care potentially offers them the ability to connect with a provider within the comfort of their own home. This can also hopefully translate to cost savings. So not just for people who need to maybe drive, to a mental health care provider's office and all of the costs sort of incumbent upon that, but it could also save in time, right? If you don't have to travel, a long distance, maybe you don't have to take as much time off of work. But the other piece here about digital mental health care is it doesn't have to mean that you're meeting one-on-one with a provider, right? It can mean kinds of interventions that are standalone, that don't rely on an hour or what have you of a provider's time. And so because of that, it means it can be more easily scaled, right? So a single sort of written program, smartphone application, website can be used by potentially infinite numbers of people, right, at the same time, versus being able to only talk, right, with one provider at one time. So all of these things hopefully can also be something that's really easy to use. Digital mental health care typically doesn't rely on any sort of specialized technology. It can be something that you already have in your pocket or on your desk. So in the same way that you might get a DoorDash delivery for lunch, maybe less these days since things have gotten a little bit more expensive, digital mental health care can be delivered via websites and smartphone apps, as well as, like I said, other devices. Of course, it's not all, an easy road to being able to provide digital mental health care to everyone. So for example, these options often require access to an internet connection. So sometimes this even means a higher speed connection or a really good deal of mobile data streaming. And so that can reduce access for some people who don't have that level of internet connectivity. Additionally, like I mentioned before, that sort of potential benefit of the reduced stigma about seeking mental health care, well, some people don't have a private space that they could use to access mental health care in this format. So this may not be as something that's as accessible to people who, might have those kinds of concerns. And then lastly, of course, there are people who are just for any number of reasons less comfortable with technology. And so they're less likely to utilize these kinds of options. So rather than considering digital mental health care as a total replacement for existing treatment delivery formats, you can really think of it as like a supplement, right? Something that for now is probably better suited towards people who are really comfortable with technology, who have a private space to be able to potentially meet with someone or engage with this mental health care in some fashion, as well as a reliable internet connection. So through research, we hope that we can improve digital mental health, not only so that we're able to provide access to care to people like that 15-year-old or those who otherwise might not be able to access it at all or as quickly, but we also hope that we can sort of relieve some of the pressure, right, on the existing mental health care system, making it more effective and accessible for everyone who utilizes it. Essentially sort of being able to triage people into the level of care that they need, so maybe they need something that's less intensive, and that means that overall, more people can access the mental health care that they need, and when people need more intensive kinds of treatment options, maybe it's easier and faster to get able to connect those people to the treatment options that they need because we sort of relieved some of that pressure and offered some more availability to try to meet that demand better. So my particular research focus is particularly about depression and alcohol, and especially how those two things overlap for a lot of people. So about, as of 2019, at least, an estimated 8% of US adults met criteria for what's called a major depressive disorder, or depression, in the last 12 months. So we're basically talking about for every 100 people with depression, about 2/3 of them actually received some form of treatment for that depression in the same time frame, whether that was antidepressants, therapy, a combination, or other kinds of treatments. Right? So that's pretty good. Right? We obviously want people to be able to access treatment if they want it, and 2 out of 3 is going to seem quite high compared to us talking about substance use now. So in the same national study, right, we found a similar number of adults met criteria for alcohol use disorder in the previous year. But when we're looking at for every 100 people with a substance use disorder, so this is sort of zoomed out, right? Substance use disorder is not just alcohol specific. But we see that only about 10 of them for every 100 receive treatment, right? So a significantly lower proportion, right, of those who met criteria for any substance use disorder. So my work is basically intended to try to combine what we already know, these research-backed treatments, and be able to utilize the technology that a lot of us are already kind of carrying around or already have access to be able to kind of help close some of these gaps. So I'm examining how a research-backed treatment called behavioral activation, which was a treatment developed to treat depression, but it's also been used as an intervention for risky alcohol use, how that can be adapted to a smartphone app, right? Instead of sort of in-person mental health care, how we can have this be delivered from someone's phone. So behavioral activation, probably a new term to most of you, works through supporting individuals in shifting their behavior to better align with their values and improve their mood. So essentially, when people are feeling low mood, this tends to be associated with low energy, right? So this ends up sort of forming into this cycle here, which leads to people not engaging as much or at all with activities that are meaningful to them, that they enjoy, and it often results in them also withdrawing from or interacting less with their social network in this sort of ongoing cycle here. So what behavioral activation strives to do is to help people connect with their social network, engage with those activities that matter to them and align with their values, which research shows us can help work in a kind of outside-in kind of way, helping people to raise their mood and energy levels in a more hopefully positive kind of cycle, right? So this is probably something that sort of stands in contrast to what you may have heard about other kinds of mental health treatments that start with, well, can we work to kind of change how we're thinking about things? And this instead works on, well, can we change how we're behaving about things to then be able to kind of help break that cycle of depression in this case. So what we also know is that treatment outcomes when people are experiencing both depression and engaging in risky alcohol use are typically worse when that is co-occurring. So an intervention like behavioral activation, which has been well established with depression treatments and also has increasing amounts of evidence as a treatment for risky alcohol use, may be just the thing to be able to more effectively reach those people. So I'm particularly interested in people who have that overlap of depression and risky alcohol use who are also young adults. So part of the reason for that is that this population, typically we're talking about people between the ages of 18 and 25, show pretty high rates of depression and also the highest rates of any age group on risky alcohol use. Additionally, they have the highest rates of that co-occurrence, right? That overlap of depression and risky alcohol use. And they also, fortunately for my research, typically have a pretty high degree of technology fluency and also just sort of like tech usage. Right? Unfortunately, though, they have some of the lowest treatment-seeking rates. And part of the reason for that is that they often have less disposable income than a lot of other older age cohorts. So we're hoping that digital mental health care can provide a easier and also cheaper way to access care. Right, so if we can use this research to help tailor future apps to the young adults' different wants and needs than the general adult population, hopefully that will sort of help demonstrate why targeting this population may be particularly beneficial. Right, so hoping to kind of take away from this, right, how do we sort of assess these treatment targets, how we think that the sort of mechanisms of behavioral activation work, how do those actually relate in day-to-day people's lives, their behaviors, to both depression symptoms and how they use alcohol, so that we can take that knowledge and then apply it in a digital mental health care context. So my study for my dissertation uses 21 days of measures focusing on a young adult sample. And so we ask people through these daily surveys, through these daily just web-based surveys, it's just the question of like, okay, well, how much are you drinking, right? On a day-to-day kind of basis, what does that look like? Also, are you experiencing any problems related to that drinking? So something could be a hangover, could be problems interfering with their work or school, covering a wide array of possible problems related to alcohol. And then we also ask them what their motives are for drinking, because we know that alcohol-related problems tend to track differently if someone is drinking in a social context versus drinking to kind of help improve their negative emotions. We also, of course, ask them about their depression symptoms, if any, and those behavioral activation treatment targets, like how much are they already or not, engaging with those. So hopefully, by engaging in these behavioral activation treatment targets in activities that they find rewarding, how much they feel like they're living their life in accordance with their values will really help us better understand the relationship between these different behaviors and different experiences. So my essential hypothesis is that greater engagement with those behavioral activation treatment targets will predict fewer depression symptoms and less risky alcohol use. And we're also trying to understand a bit better the relationship between depression and alcohol use. So we expect that it will be a bidirectional relationship, with more depression symptoms predicting more alcohol use and vice versa, but we're hoping that this will also help contribute to that understanding. So once we've finished collecting all that data, analyzed it, sort of where to from here. So we're hoping that a standalone digital mental health care app, so an app that doesn't rely on necessarily a provider's time, right, that someone could access anytime, like any place when they needed it, that's targeted for the young adult population, could provide these cost savings that I talked about and also that easier access to care. And not just any care, but a research-backed treatment option, right? Because I don't know about y'all, but if you've ever been to the App Store, on an iPhone or the Play Store on an Android, right? It's kind of like the Wild West out there, right? We don't have a current great way for people to indicate that, yes, this is an app that, has been tested, is backed by research. For consumers, it's just, this wide sea of all these options that can make these claims, but could potentially not only be a waste of their time and money, but could also potentially be harmful. So we're looking to find ways to be able to provide people with, connect people with these kinds of research-backed treatment options in ways that work best for them. So additionally, this is hopefully, like I said, a young adult specific treatment education and skills practice and support kind of app, because we know that interventions work best when they're tailored towards the population that they're designed to be used for. And then also using that technology that the app or the sort of the phone in general has in a way that being able to just meet with someone in person on a week-to-week basis may not be able to provide. Right? So an app could do things like a time or GPS prompted notification reminder. Say someone enters into the app that it's often around 9:30 p.m. that I start thinking maybe I'll go buy a six-pack from the corner store. And so maybe having some time prompted notifications to practice some of those skills might be able to intervene on those behaviors in a way that a typical therapist would not be able to do with that kind of regularity. Or for the GPS prompted notifications, maybe you have a notification that prompts when someone gets too close to their favorite bar that they typically go to. So these kinds of things, right, can not only just use technology as a delivery platform, but really integrate these things to be able to provide services that at this point through traditional mental health care we're not really able to do. So sort of the lay of the land right now is that there aren't any current smartphone apps for both depression and alcohol use. So hopefully we can use this research, as I've been saying, to tailor future intervention apps for this population. So, thank you.